Nelson Mandela's fragile health brings our attention to the chronic lung condition that he suffered with since being imprisoned on Robben Island for 18 years. Arise News medical contributor Aletha Maybank is here to explain that and some of the other stories that are making top medical news this week. Hey, Dr. Maybank, how are you? Feel funny calling you Dr. Maybank, although you are. Hey, Aletha, what's going on?
Thank you.
It's no laughing matter. Of course, it's been well reported that former South African President Nelson Mandela has had chronic lung infections, problems with his lungs ever since contracting tuberculosis back when he was imprisoned. Let's talk a little bit about what he's dealing with.
Sure. I mean, right now he has a lung infection, and lung infections can be caused by viruses, funguses, or bacteria. And so we know in 1988 that he did contract tuberculosis, had pretty obvious symptoms of active TB, coughing up blood and sputum, was treated at a hospital and then released. Now, tuberculosis is a pretty deadly disease. It's also highly contagious. You get it from talking, you get it from sneezing. It's very easily contagious by just droplets coming from the mouth. Of the 9 million people that actually in 2001 got TB, 1.4 million died. So it's a pretty deadly disease, and those with HIV/AIDS even at a higher risk of contracting TB and potentially dying from it. The interesting thing about Nelson Mandela, is that his TB, even according to him, was treated pretty early, and according to the doctors, really didn't have lung damage that may have caused some long-term problems. What the thinking is that possibly, he worked in a lime quarry, not really worked. They were forced to work and labored in a lime quarry for many, many years. Lots of dust, lots of potential to get into the lungs for many years. And that can cause something called pneumocomiosis. And that actually is where the dust gets in, the lungs react, it becomes inflamed, and then becomes scarred. And for many years, you can have damage to your lungs and possibly more susceptible to infections that he may be seeing right now. But also a product of his age, of being older age, also makes you more susceptible to having pneumonias.
Yeah, absolutely. And with the lung infection that he's dealing with, and his age, as you've already mentioned, we've heard a lot of reports, Aletha, about he's getting better, he's critical. We don't know when, and that now he's getting better, he's critical. Is that typical of the cycle of a lung infection?
I mean, it can be, yes, and it depends on the seriousness and if somebody's had them quite often in their lungs and how strong their lungs are per se. But he's also 94 years old, and his body is just not as strong as it used to be in order to fight all of this on his own. And so it's taking a lot of support. He's had to have some of the life support to help him breathe where he didn't need to have it before. So it can be typical of the course at this point in his life, and also for whatever the actual lung infection that's actually happening.
And of course, we have to note that neither of us have any personal knowledge of his medical records, his condition. We've not treated him, so we're just talking in generalities.
Absolutely, and that's an important point too. This is his private condition, and this is just information that should be shared between patient and doctor and not with the rest of the world.
Okay, so let's move on. You mentioned how those who have tuberculosis are particularly susceptible if they're HIV positive. Well, yesterday was National HIV Testing Day. So where are we in the fight against HIV?
Well, we're still fighting it. We have seen many declines in new infections across the world, especially here in the United States. However, what we still know is that 20% of the people who are HIV positive actually don't know it. So that's about 1 in 5 people. And so this fall, this past fall, which is pretty interesting, Quick came out from the company OraSure for the first oral in-home test. So now, instead of a person having to go to their doctor's office or some other provider, they can get the test, buy it in the store for about $40, and do it in their home. And the way that they use it is there's a slight device that's right here, oops, and some solution.
Don't worry about that. Go ahead.
Got spilled. But you take this and you rub it along the gum line, and you stick it into this solution. You wait for it about 20 to 40 minutes, and you will have a result back. Now, what the result tells us is that if it is non-reactive, or what we would say negative, it actually is pretty accurate. That's the question I get asked a lot. So is this accurate? I'm doing it in my home. And it actually is extremely good, 99.9% great at letting you know that it's negative. Now, if you get a reactive result, which is a preliminary positive, and that's very important to know that it's preliminarily positive, the accuracy is not as great, but it's still pretty good. It's 92%. And so at that time, and it can be, there's still a lot of stigma around HIV/AIDS, and it can be a pretty scary thing if it does become back reactive. And what we say is if you have a health professional, contact your health professional. There's also a 1-800 hotline number here that you can call 24/7. But it's very important that if it comes back reactive, that you definitely follow up, because what the power is that if you do test positive for HIV, you have the opportunity to get into treatment early, which means you have a lot of years to live. It's not a death sentence anymore. You can live up to 20 years plus and have a very productive life if you get in treatment. The other big thing is that if you are HIV positive on treatment, your chances of spreading it to somebody else can actually decrease by 96%. And so that's why, everyone's like, well, it's in the home, do we really want to do that? But at the same time, I think a lot of public health professionals and medical professionals have really weighed the benefits and risks and feel it's important that people have more access to the test.
Yeah, that's very, very important. And it is, in fact, better to know than not to know.
Absolutely.
Dr. Aletha Maybank, thank you so much. It's very important. We appreciate it.
You're
Have a good weekend.
You as well.
And you're watching Arise America.